You're watching once again a YouTube video presentation of the University of Wyoming Center on Aging. I'm Scott Veach. I'm your host, and on this program we'll be discussing topics of interest for caregivers of loved ones with dementia. We hope that you will subscribe to the channel and you'll hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new program. And now, this is Once Again. My guest today is Dr. Zoe Kriegel. She is an assistant professor at the University of Wyoming. We've been talking about the role of speech and language pathologists in dementia care. And if you weren't with us for part one, it's already posted, so you can just back up a little bit and take a look at that if you haven't already been with us for part one. During part one, we talked about what the speech and language pathologist can and cannot do. We talked a little bit about the abilities that need to be dealt with, some of the conditions. And today we're going to concentrate a little bit more on the caregiver's role. Thank you so much for being with us again on part two. Let's talk a little bit about that. I mentioned it in part one. The speech language pathologist can't be there 24/7, obviously. So what's the role of a caregiver in all this?
Yeah, the role of the caregiver, especially as folks who are really in the day-to-day with their loved one with dementia, is aside from all of the roles that they're playing, when I think of how I would partner with a caregiver, it's really identifying the troubles that they're having at home. And so that may look like writing down, like, we had this interaction and it really didn't go well. And taking a few moments and writing that down. And when those few interactions that, gosh, they just didn't go well between the caregiver and their loved one with dementia, when you bring those into an assessment or an evaluation with a speech language pathologist, it really starts to paint the picture of like, okay, what's really going on in this
Mhm.
interaction and where are things maybe not going well? And so I think about the caregiver really being the window into what's going on in the day to day. And then we can work together to start talking about what are some potential solutions to that.
Mhm. I like that, the window into what's going on today. What about, does it matter the relationship that the caregiver has with, call it the client or the person who's living with dementia? Does it matter if it is a spouse or perhaps an adult child? Does that change things at all?
That's a good question because each person, whether it's a spousal relationship or a child and parent relationship, will be so different and have a long-standing history. And some of that history will be wonderful and loving. And
Hmm.
if you've lived with anyone for any amount of time, some of that history is a little tough and has some jagged edges on it.
Yeah.
And so I think what's most important is that no matter what your relationship is with the person that you're providing care alongside, is noticing a change in yourself. So if you feel like during your conversations and your interactions with your loved one with dementia that you're becoming more irritable or less patient than what's normal for you during these conversations, that's a really good cue that things aren't going well in your conversations and in your communication, and that both of you could probably use some additional support.
What are some of the maybe the red flags or yellow flags that the caregiver needs to be aware of that, maybe this is something that the SLP could help with?
Yeah. So I think when, particularly during communication, if the person with dementia is becoming distressed, and or the caregiver is becoming distressed by the person with dementia maybe not remembering something that's seemingly important or not remembering something that you've talked about several times and now you're feeling frustrated by that. So those almost less about the specific items that are red flags and more about how are you responding to that and how are you feeling about that? Because someone may not remember things and it may not bother them, or it may also not bother the care partner, and that can be okay. But when it becomes bothersome, it's important to recognize that and recognize the magnitude of those feelings and then seek out support.
The thought just came to me. What do you call the meetings with the client? Do you call them sessions or programs, and do you refer to the person as the client, or what's the?
What an interesting concept, because it can vary depending what setting you're in. So when I worked in a hospital setting and people were inside the hospital admitted, we called them patients. They were in the hospital for being sick. But usually we'll think of an evaluation or an assessment. That's kind of the starting point where we'll talk to the person living with dementia and or their caregiver if that person's involved at that stage. And then we usually think of our sessions as treatment sessions. And so we're providing treatment alongside the person living with dementia and their caregiver. And there may be reevaluations or 6-month evaluations or 3-month evaluations. And then when the goals for that treatment plan have been met, then we may consider discharge or discontinuing speech language pathology services. And that decision is made in consultation with the caregiver and the person living with dementia.
Do you ever do the sessions at home?
Yeah. So things can vary. And I think in the rural healthcare setting, that can certainly vary too. So, usually, especially for folks living with dementia who are still living at home, those sessions can be outpatient. So, there might be a rehab facility or a hospital near someone's home that they go and visit. And then there may be home health available in anyone's region where they live. And so there may be home health agencies where a speech language pathologist works for that agency, and then they go out into the community and visit folks in their homes.
In part one, you talked about at the very beginning about your coming to Wyoming and the fact that the University of Wyoming serves a large geographical area, and a thought just came to me too. Speech and language pathologists available throughout the state? Are there some areas that are really, it's tough to find that help?
Yeah, I think that there's generally a shortage of speech language pathologists, as there are shortages of important folks like nurses and
Yeah.
physicians. And, that's something that's not new for folks living in Wyoming. What's really neat about speech language pathologists that is in contrast to some of our friends in rehabilitation, like physical therapists or occupational therapists, is that sometimes in some situations, for some families, telehealth can be a really viable option. So for us, again, depending on what we're treating, maybe not dysphagia, but there's some wiggle room there in some cases. We're able to communicate with folks and provide treatment using telehealth services, again, in some
Right.
situations.
Yeah. But there still is a shortage. I mean, I would guess in some areas it's pretty tough to get an in-person visit.
Sure thing.
Yeah. Um, so as far as the caregiver is concerned, getting back to there, do they have to be in the session? Is it better? Does it matter?
That really depends on, of course, like every answer that I'm giving you, it depends on
Sure,
the
sure.
person and the situation. So I know sometimes folks earlier in their diagnostic process may want to attend their sessions on their own and not have a caregiver in the room, and that's fine. There may be times where it can become more helpful or even almost more focused on the caregiver and what they can do to support their loved one living with dementia. It seems to be that a lot of folks choose to come together. So, as the person living with dementia and as the care partner, come together to the sessions, but it doesn't have to be that way. And that's kind of part of us walking through that process with our clients and their families and thinking about, what do you want? Why? What are your preferences? How might that change? Is that the same today as it is next week?
One of our programs recently was with Nancy Norton, who is an attorney in Jackson, Wyoming, and we were talking about some of the legal aspects or legal considerations that someone who is a caregiver might want to consider. We had to put kind of a disclaimer in there that, of course, every situation is different, and we encouraged everyone to seek their own professional legal help. Kind of the same thing here, right? Every situation is different. And so you can't say one size fits all when it comes to treatment. Is that fair?
Yeah, I mean, that's absolutely fair.
Yeah.
And coming from a lawyer, we'll stick with that
Yeah,
advice.
there you go. Yeah. We're coming up. We flew through two programs here, covered a lot of great information. Let me ask you this. If you could give one piece of advice or one suggestion to the caregiver of someone living with dementia as far as the SLP input is concerned, what would it be?
Really just to listen to yourself. So if you are noticing that you are not quite handling conversations and communication as well as you know you can, maybe you're feeling more frustrated or irritable than usual or less patient for yourself.
Mhm.
That's the time to check in with your doctor, with your own doctor, and also the physician that's primarily caring for your loved one with dementia. I find usually that folks, once they've realized, like, okay, I think I'm ready to ask for help, they probably needed it a little while ago. So listen to yourself the first time when you start to notice those feelings of frustration or feeling like maybe I need a little bit support. You're probably right. So go ahead and seek that support. We're happy to help you.
Dr. Zoe Kriegel has been our guest. She's an assistant professor at the University of Wyoming. We have been talking about the role of speech and language pathologists in dementia care. Thanks so much for being with us today. And we
Thank you.
want to thank you for being with us as well. And we invite you to join us again next time on Once Again. You've been watching Once Again, a YouTube video presentation of the University of Wyoming Center on Aging. We hope, if you haven't done so already, that you'll subscribe to the channel and hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new video. Thanks so much for being with us. I'm Scott Veach. We'll see you again next time.